kidney problems isn't something that you normally think about when you think about diseases or issues you may have to worry about. But the kidneys are a very important organ in our body. They help to keep us healthy by filtering waste, balancing fluids, and helping to control blood pressure. With me now to discuss kidney health is our good friend, Dr. Frederick Smith. He's a nephrologist, and he's here to learn us a little something new about kidneys. Good morning, and welcome back to Hours of Sunrise.
Well, thank you very much. I'm not sure if there's much I have to learn you new, but I could try learn you something this morning.
Awesome. Let's go back to basic biology. What are the kidneys and what do they do for the body?
Well, quite. I actually, if you ask any nephrologist, it's the most important organ in the body. Okay, so let's just get that
Yeah,
right off the
right.
top, right there. That's what it is. So what do they do? So we're responsible for multiple things. Predominantly, what we know is, or what people know about, is excretion and filtration. Big words. Let's break it down a little bit. Getting rid of the waste in the body, and also trying to regulate different things like electrolytes, sodium, potassium. And those things are important because if they go off, they cause heart problems and brain problems and every other kind of problems you can think about. So it regulates or it filters things. Not only those things, but it is also an organ. Even though you're thinking it's just excretion and filtration, it also helps with other things, with glucose control, with bone growth, or the maintenance of bone health, so to speak. So yeah, I think it's up there. It's number one somewhere.
Yeah, it seems like it's an all-arounder. In terms of kidney health, what's the Bahamas' I guess, prognosis or outlook in terms of kidney disease? How many of us are impacted by some form of kidney disease, and what's the typical, prognosis or outlook?
So quite interesting, quite interesting. So and again, being involved in everything is this jack of all trades. So truthfully, I think that most things we do have some components where we have intrinsic kidney disease or disease that's primarily because of kidneys and kidneys alone, and then it causes other things. But I think in our population, what we are finding is that the diseases we get from kidneys are predominantly not just kidney related, but because of the other organ systems. So I guess anybody that's been around and heard me talk, I always talk about the other markers, neck circumference because it's called too big, and waist circumference because then it's too big, arm circumference again because it's too big, and the whole thing we call metabolic syndrome. Because in the Bahamas, and I use this phrase all the time, we think that the healthy baby is the big baby. Absolutely, probably not.
Bouncing baby.
That bouncing baby, no, that baby too fat, eh? And so when we go back into the whole concept of metabolic disease or metabolic syndrome, which is probably becoming the number one cause of kidney disease in the country. What it is when we take our weight and put that pressure on the kidneys, then it's too much, and that burden then becomes metabolic disease and causes kidney dysfunction. So we throw in there the weight, we throw in there the diabetes, we throw in there the hypertension, we throw in there the sedentary life, not like you because you'll be rumbling through the bush, but we throw in there the whole thing with the way that we sit down all day long and we don't get up when we don't move. I heard some other wonderful ladies in the house this morning talking about exercise.
Yes.
We don't exercise. We park at the closest parking spot to where we want to go.
Straight
and
into the elevator.
Straight into the elevator. We don't walk the stairs. And truthfully, when we're in the parking lot, if somebody try to go in that spot right next to the entrance, we want to fight them, right?
Right.
But truthfully, what we need to do is start implementing more exercise because metabolic syndrome, which I think is now becoming the number one cause, is because of sedentary lifestyle. With the sedentary lifestyle, we're gaining weight. With the gaining weight, then we're starting to develop diabetes and hypertension. With the diabetes and hypertension, all the kidney that you have, you're born with.
Yeah, that's
So
it.
when you put more and more on top of that in terms of the burden because of the diabetes, hypertension, and the weight, and there you have it, our kidney disease.
So, in terms of preventing, certain types of kidney diseases, where is the best place to start? You described this kind of holistic approach to health and being active, but I guess where do you get most bang for your buck? Is it that as you're young, you're staying away from sweets and treats and fried foods, or you can eat those things but have a healthy lifestyle, drink lots of water? What's the formula to have a kidney?
So my take on it is enjoy what you want in life, right? Enjoy the things you are. That's what, and I say this in the church may agree. That's what it was made for. So even in terms of we're a nation and there are lots of things that we love in our country. We love to have a little cocktail at a time, and we love to have a little cigar at a time, and I'm not going to straight up go out and advocate all of the vices, but what I'm going to say is if you're going to have your vices in moderation. And even the healthy things in life, I'm going to say do them in moderation because, again, Look at even exercise. Too much exercise can cause muscle breakdown. Muscle breakdown causes kidney disease.
Yeah.
Like, is the possibility of it if it's not excreted well. So where's the bang for the buck? I say it starts with lifestyle.
Yeah.
And healthy lifestyle is where it starts. It starts with moderating what we eat, and not just what we eat, but how much of it we have, what we drink. Again, we talk about water. So we do like the 8 glasses of water per day. But again, too much water is also a problem because too much water gives you that urine that's like pure white, as opposed to urine that has a little color in it that says that we're getting rid of the excess things that we need to get in. So too much of anything is good for nothing. But what I will say is everything in moderation. Make sure the exercise is in moderation, bang for your buck. Make sure that the food choices are in moderation, bang for your buck. Even our lifestyles and the way that we live, we gotta work. Because if what the Bible says, by the sweat of your brow you shall eat bread. But if you don't work, then you can't do those things, but you work too much. So they say night is made for sleeping, so to speak, right? So you have to balance with our wake versus our sleep timers so that we get pure, proper cell regeneration.
For those who don't want sweat, for them to slide in a hand is get bread. But anyway, that's a whole other topic. I want to talk about the kidney patient. I want to talk about the patient that's on dialysis.
Yes.
And I want to talk about the support system, the medical team, everything that goes into that. My father was on dialysis for 7-8 years until he passed. And I just want to say shout out to all of his doctors, the nurses, those who stand there, at a dialysis lab, and they're with them every day that they're in there, and they're taking care of them. I just want you to speak to the patient, the types of things they go through, and just how we can be more understanding as people for persons going through dialysis.
So I'm gonna, for you, and you say dialysis, and then in my typical way, I'm gonna switch that conversation a little bit. So what I'm gonna say is renal replacement therapy.
Yes.
So renal replacement therapy then includes dialysis, and dialysis can be done in 2 different ways. It can be done through the blood, what we call hemodialysis. It can be done through the tummy, what we call peritoneal dialysis. It can be done, you can do renal replacement in another way, in what we call transplant. So you have to put a plug out for transplant, and I know that multiple centers are going towards transplant now. In the public sector, we have PMH, PHA system. In the private sector, we have Doctors Hospital moving towards the transplant programs. An organ from you to me, well, hopefully I'll be the donor and you'll be the recipient, because I don't plan to have kidney failure anytime soon. But we talk about transplants, and that's one thing, and then we go to dialysis, and then it's also the whole concept of your choice, if you decide to do neither of them. However, with dialysis, what we look at dialysis is in the beginning life-saving, then dialysis becomes life-sustaining. If we do hemodialysis, it's typically 3 times a week, 4 hours each time on average. And if we do peritoneal dialysis, it's fluid that goes in the tummy. You put the fluid in, it stays in the tummy, you let it out, and with it goes the toxins and the wastes. And then what we do is you do that 4 to 5 times for the day, in and out, and you do it in the convenience of your own home. So one is supposed to allow you to be a little bit more free in what you're doing in terms of doing it on your schedule, and then the other causes you to be our guest for 3 times a week, up to 4 hours each time.
I'm getting the wrap, but I appreciate you speaking on behalf of the patient. I want you to say where people can find you if they need to get a check, if they have questions about their kidneys. Just where can we find you?
Well, great. Where you can find me now. First of all, that check is not that written check, but however, so what we do is I'm at Princess Margaret Hospital as an employee of the government. I'm at Doctors Hospital, and it can be through CMC or Central Medical Center on Collins Avenue. And I also practice at an office called Bahamas Surgical Associates. That's just off of Collins Avenue on Aubrey Lane.
Fantastic.
Sorry, East Terrace.
Dr. Smith, I appreciate you. I always learn so much from you. We need to have this conversation again, because we was just getting to the good part.
To the good part.
We need a 2-hour show.
No,
Thanks for
that's
being
6
here
o'clock
this
in the
morning. We
morning.
appreciate you. You're watching Mamas at Sunrise. Take care of your kidneys. Hey, and if you have a good one, why not donate it? Think about it. Have a great one.